Hello, it's your drug dealer. I thought I'd call in case you needed anything at all. You know, you can always call me just to talk, but I mostly want to sell you drugs.
Hey Professor, how's it going? You wanted to see me? Thanks for coming to my office. I brought you here because I want to give you an exam. A test? Already? It's the first day of class. Oh, I hate my P3 year already. I mean, I didn't even bring a pen. This backpack's just for show. It's the first day. This exam won't count towards your grade, but you're a P3 now. You really need to start deciding what type of pharmacy you want to practice. If you decide that you want to practice hospital, we want to make sure that hospital pharmacy is for you. If you want to practice community pharmacy, we want to make sure that community pharmacy is right for you. So that's why we're going to make you take this test. It's a 50-question test. Shouldn't take that long. You decide which type of pharmacy you want to practice, take the test, and when you come back, we'll go over the results, okay? Ooh, specialty pharmacy? Yeah, I ain't smart enough for that. Hospital? Oh, that's boring. Independent? Ain't nobody got no money for that. Community pharmacy. Alright, here we go. Ooh, 50 questions? My gosh, let's get started. Question 1. KA is a 32-year-old female who brings a prescription to the pharmacy for ProAir and clindamycin. Her current medication includes alprazolam 1 mg, fluoxetine 20 mg, and zolpidem 5 mg. You're about to call the doctor's office because you received an e-prescription for amoxicillin suspension, in which the dose may be too high for the child, and the mother is patiently waiting in the lobby. You have a person who has been registered for a flu shot and has been patiently waiting for 10 minutes already. KA begins to scream and shout because your technician told her it would be 15 minutes, and she insists that all you have to do is slap a label on it, and her dog is in the car. What is the best way to handle the situation considering you are working for a major retail pharmacy chain? Finish making your phone call as the mom has been patiently waiting even though the call may take some time to get a hold of the doctor. Sounds about right. Take care of the patient who has been waiting patiently to get her flu shot and Shingrix shot. I mean, they have been waiting. Since the patient is hollering and acting a fool, hurry up and quickly fill her prescription as she is demanding the number to corporate and says she will give a bad survey. I mean, she needs to wait her turn. Who cares if she calls corporate? I mean, corporate will have my back. And who cares about those survey scores anyway? They don't mean anything. Or options 1 and 2. I think the first 2 choices is the correct answer. The customer is always correct in retail pharmacy. That's definitely false. I mean, the customer can't always be correct. Your pharmacy manager tells you that you must complete pharmacy calls before the end of the night or there will be disciplinary action. You have been working from 8 a.m. to 8 p.m. with only one tech, phones ringing off the hook. You haven't taken a lunch or bathroom break, non-stop drive-through, and you've already given him 25 flu shots? This can't be realistic. Who made this fake scenario up? This college of pharmacy, I tell ya. You have 20 minutes left in your shift and you still have 2 people waiting for flu shots if you've not started making any of your 30 pharmacy calls yet. Which of the following is the best answer? Leave a note for the pharmacy manager for in the morning and let them know you didn't have time to make the calls? I mean, if you didn't have time, you didn't have time. Who cares about those calls? Stay 30 minutes to an hour late after your shift to get the calls done, as corporate doesn't care about pharmacists working off the clock to get things done since they purposely understaff the pharmacy all the time. I mean, that That just does not seem right. Like, pharmacists don't work off the clock. Just click the calls quickly as complete, as your district leader only cares about numbers and not if the calls were made or not. Answers 2 and 3 only. Well, I don't think pharmacists are allowed to work off the clock. And I'm pretty sure district leaders don't just worry about numbers. They actually care about the patients. So I'm going to have to go with 1. I'm going to just have to leave a note for the manager in the morning. I mean, I'm sure they'll be understanding. And I'm sure corporate will understand when the pharmacy manager tells them that we just didn't have time to get the calls done. Retail pharmacy chains care more about patient care than they do company profits. That is definitely true. I mean, why would they care only about profits? Question 5. How often will you get yelled at working in a retail pharmacy chain? Option 1, 12 times per year. Option 2, 12 times per month. Option 3, 12 times per week. And option 4, 12 times per day. 12 times per day? That's crazy. I mean, pharmacists have doctorates. Who would yell at them? 12 times per week. That seems a bit much too. I mean, pharmacists are healthcare professionals, so 12 times per month, that still seems a lot. I think 12 times per year is the correct answer. I mean, getting yelled at once a month, that seems about right. 40 more questions. Well, I mean, this test doesn't seem hard at all so far. Hey, so how did I do on the test? I wanted to go over the results with you of your exam, and it looks like you failed it. Yeah, you actually scored in the 10th percentile, which means that if you were to go into community pharmacy, after working there for 10 months, you would either quit or just hate your life every day. So, based off this exam, I don't think community pharmacy is for you. What you're saying, but I really want to work community pharmacy. Really want to do community pharmacy? That's fine. I don't want to talk you out of it just because of this exam. But I just don't want you to end up like Dr. Shaw. You really need to go look at RX Comedy and watch his videos, and then come back and let me know if you still want to be a community pharmacist, okay? Alright, I'll see you in 1 week. Hey, I saw Dr. Shaw's YouTube channel. Yeah, I definitely don't want to do community pharmacy. Actually, I don't even know if I want to be a pharmacist at all. I'm dropping out next week.